Okay, hello, thank you so much for coming. And today I will speak about the new brightening skincare and today's event called Reducing Inflammation and Pigmentation, because inflammation and pigmentation, they are linked to each other and very much related. So before I start, a couple of words about me. I am Dr. Tiina Meder, in case if you don't know who I am. And what you should know about me, I am specializing in aesthetic dermatology, obviously. I work in this field since 1996, and I'm specializing in research and development of the skincare, but my first specialization, I'm cosmetic safety expert. And I worked for many years in the Cosmetic Safety Commission. So my field of work is I'm this boring person who is always saying, no, I don't like it. It's not safe. So everyone hated me. Because every time when I came to discuss new ingredients, everyone was very excited and I was like, no, I don't like it. And first time I liked something with all my heart, it happened to me in 2006. And it was the same day when in the conference about the raw material, researcher and scientist presented probiotics and peptides in the same day. And first time in my life, I've seen ingredients more efficient than everything traditional we've got previously, including retinol, glycolic acid, which I loved enormously. But peptides and probiotics, they have even higher efficiency and zero side effects, like the safest ingredients ever. And since this moment, I love peptides and probiotics. And I came with this idea to big brands in laboratory when I worked previously. I was a head of international training in the big Swiss laboratory, and I was a medical director of the training team in the big French laboratory. And I came with this idea to use peptides and probiotics to both of them. And both of them told, too complicated, too scientific, too pharmaceutical, too new. Forget about it. It will never be in cosmetic world. And also my first idea was to introduce peptides and probiotics as an anti-wrinkle treatment for pregnant and breastfeeding women who cannot get Botox injection because it's forbidden. And all marketing and CEO of the company, they've been male, and they told me, pregnancy is such a niche market, short time, it is only 9 months. And I was like, what? They are very long 9 months, longest in the human history. So I launched the brand myself, and since 2009, we launched the very first set of professional treatments for wrinkles based on peptides and probiotics, and that's how the whole story started. And now we have 6 professional treatments, 34 of home care products, all microbiome friendly, including prebiotics, probiotics, peptides. It's still my motto. Let's use it. We don't use retinol, we don't use acids, because I don't see the point now when we have this new generation of amazing ingredients. And this year, finally, we launched the brightening collection, Lumino Derm. And since 2009, for 15 years, I've been asked by people, why you don't go for whitening skincare. And I always told them, I don't like the idea to whiten the skin. My idea is to make the skin healthier. But in the last years, we've got a new revolution and new innovative ingredients coming on the market, which can control pigment synthesis. It doesn't destroy the pigment. It controls the pigment synthesis and can reveal the natural skin color. And I use this opportunity finally to bring new brightening skincare based on the new principle. A bit of fun fact about skin dyschromia or pigmentation troubles, that it is most common aesthetic concern. Last time I've been in a few conferences. In Prague, we've got the big European conference with 200 of skin care therapists. In Australia, there's been huge conference epic, 1,500 people. And every time I ask people, please raise a hand, everyone who met patient with pigmentation disorder in the last 5 days, literally 100% of dermatologists, skincare therapists raise a hand. Because, most common, that's what people bring to us. Their dark spots, melasma, pigmentations, everything. And it's most common dermatological concern as well. And also what is really interesting, it's a stereotype that people with fair skin suffer more than people with darker skin types. Actually, it's opposite. Darker skin is higher the prevalence of the pigmentation disorder. And among the people with third, fourth, fifth, sixth Fitzpatrick type, we see pigmentation disorders like in every second woman. And most common pigmentation disorder type, they are melasma and post-inflammatory hyperpigmentation. And for me, it's kind of important point because we speak a lot about the ultraviolet. And obviously, ultraviolet triggers pigmentation. But we should not speak about the ultraviolet like main cause of pigmentation. Because the pigmentation caused by hormone disbalance, by inflammation, by the stress, by the skin damage, and triggered by the ultraviolet. If the skin is perfectly healthy, it is much more resilient. Also, the pigmentation is one of the age-related skin change. You remember children, they play on the beach, sometimes they get sunburned despite all our efforts. But do they have melasma? No. Because children's skin is much more resilient, it can heal itself much more efficiently. We should protect skin from the childhood. But with an age, the prevalence of the pigmentation disorder is increasing with every year we live on the planet Earth. So it's much more complicated than we used to say, and especially when we used to explain to our dear clients and patients and customers. And speaking about the biochemistry of the skin pigmentation, what I find very interesting that it's not only, once again, about the ultraviolet, but you can see an ultraviolet light when it penetrates through the stratum corneum, and when the protection is insufficient, obviously it's damaged the DNA. It is our main concern. Ultraviolet can cause the DNA mutation and can trigger the skin cancer. But also the ultraviolet stimulate the synthesis of many different substances in our skin, including POMC, that's propionmelanocortin, hormone-like substance, which is activating the synthesis of endorphins, hormones of happiness. That's why people love sun. And that's what creates the sun addiction. Because we feel happy when we're exposed to the ultraviolet. And when we speak with people like hide from ultraviolet, hide from the sun, avoid sun completely, it is not right. Because some amount of sun we need for everything, we need for our health, including mental health. And that's when summer feels like a happy time, despite our age. It's not because of school holidays, it's because of beta endorphin. And also, endorphins and propionmelanocortin, it's a painkiller and it's antidepressant. So it's really global approach how ultraviolet affects our skin from the damage to the beneficial effect. So, our melanocytes, they are cells producing natural protective substance called melanin, which protects our cells from the damage of the DNA, from mutation and from skin cancer, but in the same keep us open to all beneficial effects, including beneficial effect for immune system, for mental health, and for everything. And when it affects the sun, it always affects the melanocyte through hormones called melanocyte-stimulating hormones. And in each pigment cells, we have different kinds of receptors. We have receptors for hormones, we have receptors for stress hormones, we have receptors for inflammation stimulation. So our pigment cells, they are responding to different kind of stimuli, not for one only. And it produces melanin. And why I don't like to speak about I don't like the traditional approach to the pigmentation treatment, because it is based on the melanin destruction. Remember, every time when we are speaking about the pigmentation treatment, it's always like, let's destroy melanin, let's eliminate melanin, let's block melanin synthesis. But the melanin, it's a natural miracle produced by our body. In our body, a lot of amino acids circulating freely, working, functioning differently for our body. And when ultraviolet affects the skin, one of these amino acids transforms to the substance called melanin, which has darker color. And this substance absorbs the radiation, ultraviolet radiation, and converts it to heat, making it absolutely harmless for the skin. If we expose to the ultraviolet excessively, sometimes we just don't have enough of melanin and antioxidant to protect us. But if we don't have melanin at all, like for example, dermatological condition, skin condition, albinism, when the skin doesn't produce melanin at all, the skin, it is not protected. That's why hydroquinone was banned. Because hydroquinone, one of the most common substances used in the whitening and lightening skincare products, it eliminates melanin and it blocks melanin production irreversibly. And leaves the skin with white spots. In darkened skin types, it can be slightly colored, in yellow, sometimes in bluish, it's called ochronosis. And in this spot, the skin is not protected at all. And that's why I don't like traditional treatment, because it just eliminates all our natural protection. And until this moment, we didn't find a way to synthesize any kind of sun protection filter as much efficient as melanin. Melanin is still gold standard. Nature still makes it better than we can do it in the laboratory. So the best way is to keep our melanin healthy and add the additional layer of the sun protection with skincare and sunscreens, sunblocks. Also, melanin, it is a very powerful antioxidant. It scavenges free radicals. It's one of the most powerful antioxidants circulating in our body. Also, it protects cells from mutation, and it's our main first line protection from the skin cancer. And also it helps thermoregulate the body. So that's something we should not destroy, but we should make it more efficient and healthier. What is interesting about the melanin, it's not the same for everyone. We have different types of melanin circulating in our body. And it happens because of the evolution. When the humanity went through the evolution for million years, probably, the first event called darkening event happened when people left African continent. And we have two branches of people. First people go for the skin darkening event with different genes involved in the pigment synthesis. And these genes circulating in the West African population and in people who related to West African population genetically. But another tribe of people went through lightening event when they went through the ice period and deficiency of the ultraviolet. And these people are East Asian and non-African. And they're completely different genes, as you can see. They're different genetic combination. So the pigment is producing and synthesizing in the skin differently. And skin lightening event specific to the North European created this lightened skin. Skin darkening event characterizing the dark skin happened in the West African population. So there are different branches and different response to the ultraviolet affecting the skin. Why it's so important and why it's so interesting? Because I thought about it, and I think we found the way to restore the healthy production of melanin and keep it healthy and personalized, but suitable for all skin types and all skin shades, from the first Fitzpatrick phototype until 6 darker skin type on Fitzpatrick. And so we can focus on 2 types of melanin. First, it's eumelanin, which is typically dark brown, and another type of melanin called pheomelanin, that's so-called golden melanin, which is lighter, has this golden shadow, light brown, reddish, yellowish, different color. And actually the skin color and skin response to the ultraviolet radiation depends on the total amount of the pigment which you can synthesize. That's a fun fact, then everyone has about the same amount of pigment cells, melanocytes. That's only amount of melanin which pigment cells synthesize will be different for different people. But also the skin color depends on the ratio of dark melanin and golden melanin. And in melasma, dark spots, post-inflammatory hyperpigmentation, in all kinds of hyperpigmentation disorders, manifests eumelanin. So it is prevalent in the dark spot. In the skin with no pigmentation disorders, with no hyperpigmentation spots, that ratio with more balanced amount of dark melanin to lighter pheomelanin. So if we can eliminate the excess of dark brown eumelanin and leave the same amount of golden melanin, we can just reveal the natural skin color in all skin types and get this even healthy, useful look with restoring of natural skin antioxidant and DNA protection. Traditional pigmentation treatment, unfortunately, cannot do it. I am sure that you as a skincare therapist, skincare professional, and many of our patients and clients, they tried at least 3 of them. So we have retinol and derivative, obviously. Every second whitening skincare product on the shelf contains some derivative of retinol or retinol itself. Also, it can be glycolic acid. I love glycolic acid. I just think it should be a professional instrument. I am not very much for giving glycolic acid-based product in hand of people who doesn't understand how to use it and what it is. Also, azelaic acid, kojic acid, vitamin C, which is kind of controversial because vitamin C is so fragile. It's almost impossible to keep it intact in the formulation. And fat-soluble form of vitamin C, they are not whitening or lightening or brightening at all. And also, vitamin C absorption depends very much on the blood vitamin C level. So if you ate 1 orange once a week, probably you will not benefit from any kind of vitamin C skincare because you have enough of vitamin C circulating in your body. And skin cells just cannot take it from the skin. Also hydroquinone, which is bound in the European Union and Japan, but still on the shelf in United States of America. Arbutin, it is another version of hydroquinone, but much more gentle and safer, which is in use in whole world. Also, hexylresorcinol, even corticosteroids, they're still used, including prednisone for the skin whitening, dermabrasion, chemical peels, laser, which is gold standards for the pigmentation treatment still, and IPL and light therapy, which are less efficient than laser, but safer. What is the problem with the traditional pigmentation treatment? You cannot deny that they are efficient. They are absolutely efficient. You can lighten the skin with every kind of this treatment. And I ran my clinic in France for many years, and probably we share the same story. We have a lot of clients coming in October with pigmentation. We offer them different kinds of treatment, from laser to chemical peels, glycolic acid, skincare. In February, we kiss goodbye each other. Everyone's happy. Exactly the same people coming exactly to the same place next October with same dark spots, sometimes larger or a little bit deeper, but it is always the same story. And it is a problem of traditional treatment. It creates this vicious circle because each of them, except for light therapy and probably IPL, makes the skin more sensitive to the ultraviolet because it eliminates melanin as a natural protection from skin. It provokes the inflammation in the deep of the skin. It accelerates the rate of renewal in the skin. And finally, it leads to the photosensitization of the skin. And all kind of 2-3 months of traditional whitening treatment makes skin more vulnerable to the ultraviolet. And one day, everyone going outdoor without applying sunscreen, forgetting about it, or just spend too much time, glass of wine on the terrace on the sunny day. Classic story in France. And they're coming back because skin produces melanin in response to the ultraviolet. So it becomes so difficult to protect the skin properly after traditional treatment, then it's just impossible. So we have another darkening event and another darkening event. And obviously, it's very good for the business. We cannot deny it. It's just not good for the human skin. And we are specialists in the skin health. So my idea was to create a treatment which can maintain the skin health, avoiding this vicious circle. So we can treat the pigmentation and maintain results and keep the skin healthy. So why inflammation is so dangerous for the skin, and why every kind of treatment which provoke inflammation should be very much controlled? Because the inflammation, it is a very complicated biochemical event, and it is only event which can lead to proliferation, multiplication of pigment cells, and which can make pigment cells, melanocytes, grow. So it can provoke hyperplasia and hyperactivity of pigment cells. And pigment cells, melanocytes, they are not exactly skin cells. Recently it was found that pigment cells, they are pigmented neurons. They are nervous cells, migrated to the skin, protected the skin, but they're still part of the nervous system. So they react like a nervous system cells. They are not multiplying themselves during the life, so you've been born with the same pigment cells you have now. So pigment cells, they are more prone to the age changes because they are not renewing like keratinocytes or fibroblasts. You've been born with keratinocytes, and these keratinocytes left you many years ago because they're renewing, as you know, every 28, 45 days of your life. But pigment cells, they're still the same. So we should care about them more, but inflammation, it is a factor which damages pigment cells, sometimes irreversibly. It creates inflammatory mediators, and many of them, like cytokines, or eicosanoid or different kind of growth factors, they can damage pigment cells and make them produce more melanin even when you are not exposed to the ultraviolet. That's why sometimes our clients with chronic hyperpigmentation, especially in post-acne or post-laser, they are coming to you and they tell, I used sunscreen all the time. I did everything you told me, but the spot is back. Because the pigment cells are so much sensitized, they're just producing melanin just like that. And also, inflammation breaks the vessels capillary, creating cuperosis and skin puffiness, and stimulates the synthesis of the enzyme destroying collagenase, and blocks the synthesis of collagen. So it really accelerates the skin aging, in the same time provoking the excessive synthesis of the melanin. So when the skin is inflamed, you're always on the way to wrinkles and pigment spots in the same time. And inflammation is always followed by the pigmentation. So every kind of skin treatment which triggers the inflammation should be controlled and should be accompanied by the anti-inflammatory treatment as well. What we not do, unfortunately. What can trigger the post-inflammatory hyperpigmentation? A lot of things that should be acne, atopic dermatitis, eczema, any kind of dermatological disease, insect bites, chemical peels, laser, any kind of skin damage. No, it doesn't matter how you damage your skin. If the skin is damaged, it's always a higher risk of the pigmentation. And also sensitization by topical agent, simply speaking, that's sensitization by the skin care. And since retinol-based product came on the free market and went to the hand of our dear customers, patients and clients, it created the whole catastrophe of the hyperpigmentation and pandemic of sensitive skin. Until the moment we kept glycolic acid and retinol in the treatment room, everything was fine because we could control it. Now when they are buying retinol-based product in the duty-free or in the department store, it just creates a whole mess. So, another thing which we didn't discuss at all previously, that's the role of the microbiome in the skin pigmentation. Why we didn't discuss it? Because the science of the microbiome, it is a new science. Human microbiome project started in 2007. And every year we have more and more information about how the gut microbiome is related to the skin microbiome. Spoiler alert, very much. Everything what we eat can affect the skin condition. How different kind of microbiome changes can affect the skin microbiome. And this year I will be speaking in San Diego in microbiome conference about sensitive skin and the microbiome changes, and also to moderate some roundtable about this problem, because now it became the mainstream of the dermatology and cosmetic science as well. But a couple of years ago, scientists found that in the melasma, dark spot, pregnancy mask, and post-inflammatory pigmentation, you find 7 strains of specific bacteria. It doesn't matter what kind of pigmentation it is. It doesn't matter what triggers this pigmentation. You always find in the dark spot 7 inflammatory bacteria, which provoke the inflammation in the skin. And now they even called darkening microbiome. But if the skin is healthy and skin tone is even, it's another bacteria found in the skin which can be triggered by the ultraviolet, but for some reason didn't produce the pigment spot. Actually, there are 6 antioxidant bacteria, which apparently they protect the skin from the ultraviolet as well. There are 6 anti-inflammatory, antioxidant, anti-ultraviolet bacteria. And now when we know their name, we can promote the growth of antioxidant bacteria and suppress the growth of anti-inflammatory bacteria. So it is a new approach for the pigmentation treatment, which is very fresh, and I think it's one of the most prospective. Because we have this positive experience, right? We treat now acne with prebiotics and probiotics with great results. The new treatment for rosacea, new treatment for atopic skin, and now that's just a turn of pigmentation. We can treat it with prebiotics and probiotics. Why traditional treatments are less efficient than expected? I love to show this slide because I like to show. Look, that's a simplified scheme of the different factors triggering the pigmentation synthesis. There are just 17 of pathways. We have more than 90 of them, but 17 or 14, they are most important. What is very important to know about it, if you see that's an inflammation, the big blue circle, and inflammation is literally, I'm back, and inflammation is literally linked to each kind of pathways. And there are different cells. They are not only melanocytes involved in the pigmentation treatments. There are also keratinocytes, fibroblasts, melanocytes, immune cells, Langerhans cells, so actually all kinds of cells which you find in the skin, they're more or less involved in the synthesis of melanin, directly or indirectly. And inflammation triggers every kind of pathway. So traditional treatments, they're less efficient than we want them to be because they are not anti-inflammatory. They are not involved the microbiome, and they are sensitizing. So we can get only temporary effect with a traditional treatment. So you still can use them, but you can use them as an active treatment, like you can use the laser to treat the dark spot. Why not? It will eliminate this excessive pigment. But you should use something else for the more global approach to suppress the inflammation following the laser treatment and to get the whole therapeutic treatment of the skin. And how we can get therapeutic approach via biochemistry? That's another simplified scheme. This time it's really simplified. What is really interesting about the skin, you see, we start all together from the amino acid phenylalanine circulating in our body. Phenylalanine transformed to the tyrosine. Tyrosine, with the help, with the key enzyme of the skin pigmentation called tyrosinase, everyone knows about it, is transformed to the L-dopamine. Once again, we get tyrosinase acting on the dopamine, and we have dopaquinone. But here we have two branches. One pathway from the dopaquinone is creating dark brown melanin, eumelanin. And when this pathway is stimulated by the ultraviolet with an inflammation or stress hormone, cortisol, or any kind of hormonal disbalance, we are starting to produce more and more and more of dark brown pigment, which creates a dark spot or melasma or post-inflammatory hyperpigmentation or whatever you call it, hyperpigmentation event. But if in your body it's enough of antioxidant, and specifically if you have a higher level of glutathione and cysteine circulating in your body, and also obviously it helps to get some genetic predetermination for the synthesis of pheomelanin, you continue to synthesize golden melanin. And if you synthesize more of golden melanin, you will not produce the dark spot. Your skin will stay even. If you pathway is switched to the dark melanin, you will produce more of dark brown melanin and dark spot will manifest. So our first way in therapeutic approach is to increase the antioxidant level. Actually, you can supplement with glutathione in the active pigmentation treatment because glutathione helps to switch to the golden side. But also, glutathione can be used for the skincare. It's a little bit tricky because it's kind of fragile, and bioavailability of the glutathione, it's much more complicated. So I chose to use cysteine, another antioxidant substance, which is absolutely perfectly natural amino acid, also circulating in our body, protecting us from the ionizing radiation, and it can be applied on the skin in the form of cysteamine and brighten the skin, restoring the healthy ratio, healthy individual ratio of dark brown and golden melanin in the skin. What we can do also, we can suppress tyrosinase, which we do with a lot of active ingredients, like alpha-arbutin or licorice extract, or even glycolic acid. They're all suppressing tyrosinase synthesis. We can inhibit the activity of tyrosinase. We can inhibit the cyclization of dopachrome. It's another reaction. Also can be done with cosmetic ingredients. We can inhibit the transfer of melanin from pigment cells to keratinocytes, to the stratum corneum. First and most known ingredients able to block the melanin transfer, niacinamide. That's how niacinamide brightens the skin. Healthy way, perfectly normal, physiological, makes the skin healthier. Only problem, slow. You should be very patient to get the brightening results with niacinamide, because probably you should use the product about 6 months, 8 months, maybe 1 year. In 1 year time, you always forget why you started to use this product. And you're like, okay, I always was so beautiful. It's not about cosmetic science at all. But also now there are new ingredients which block the transfer to keratinocytes faster. For example, tranexamic acid, we use it. And also elimination of keratinocytes after transfer, called exfoliation. Every kind of peeling, do it. The most visual effect, especially great for people who've never been in the treatment room, coming for the first time in their life, like a birthday present to 67th anniversary, and you apply the simplest exfoliator, mass it a little bit, wash it off, show the mirror, miracle. Because all these dead cells with melanin can be eliminated mechanically, very easily. The problem is if you do only exfoliation, it's very temporary results for a few days, because next generation of keratinocytes with melanin will come on the surface and you will see the pigmentation again. And also promotion of growth of beneficial brightening microbiome, which is completely new approach. And if you combine at least of 3 of this therapeutical biochemical approach, you'll get results for sure. You cannot use only one of them because it will not be enough. As you remember, the skin pigmentation process is absolutely highly complicated. So we should respect this complex system and we should work on different level of the biochemistry of pigmentation synthesis. And we can do it now, just even more simplified picture, yeah, when you can work on different level from the stratum corneum on the epidermis until the deep layers of dermis. And I put the information I just colored in red because if you control the information, you control pigmentation, always. Information, it is a key for the pigmentation. If you don't control information, you will never get long-lasting results. And that's what we want, right? So, the new approach to the pigmentation treatment came via the shift of the whole paradigm. It's how it happened now in the gastroenterology. We treat gastroenterological disease differently because we know about the microbiome. And that's what happens in the dermatology now. We change everything because microbiome, it is a part of the skin. We should respect it. And also we know much more about skin physiology and about the skin biochemistry. So our approach now is more advanced and we can get less skin damage in any kind of treatment and more results. And obviously, result can be long-lasting. So it came via human microbiome project. Also, we understand now how important the inflammation is, and it is even new word, inflammation and aging all together. And also, we should respect the hormonal influence, stress level, microbiome, and the free radicals activity. So all kinds of treatments should be antioxidant. And World Health Organization just announced a few years ago that we should be aware of the skin health in the term of active longevity, because skin is the largest organ of the human body. And it is not an empty word. Every organ is connected to all other organs. And if your largest organ is inflamed, other organs will be inflamed too. For years, we've been speaking about how important the liver health for the skin, right? If you have some liver diseases, you will get your skin pigmented, the color will change, you will develop wrinkles. But opposite is true as well. Because if your skin is inflamed, your liver will be inflamed too. Your kidney will react. And now the new research showing that treatment of the skin inflammation reduce the amount of free radicals circulating in the body and really slow down the whole body aging. Really turn what we should irreversible biological clocks in our body. So, and actually it was one research, it's a long story, but I just tell it simpler. Researcher took two groups of people, 80 plus age, so really elderly people, and just get all measurement, blood test, found that they have a lot of free radicals circulating in the body and a lot of inflammatory mediators, bad lipids, atherosclerosis, what you can imagine, 80 plus, right? They have a lot of problem. And on one group of people, they offer the very simple face moisturizer and body moisturizer to apply twice a day. And 1 month later, in the group who applied body and face moisturizer once a day, free radical activity in the whole body was reduced in twice. They've got less of lipids, which can be harmful for the heart and blood vessels, and all metrics of their body have been better. They've been literally younger in 1 month and feel better, more active, more energetic. And only because simple moisturizer helps to hold water in the skin and reduce the inflammation, reduce the dryness. So it's a very simple and not expensive step which can help us live longer and live happier. So our new brightening approach, it's really different. What should we do differently? I believe we should prevent the skin sensitization instead of causing skin sensitization by our treatment. We should prevent post-inflammatory hyperpigmentation instead of causing post-inflammatory hyperpigmentation. And our approach should be anti-inflammatory, microbiome friendly, and should improve the skin resilience. So my goal was to create the product which you can use in Florida in the summer and brighten the skin, simultaneously improving the skin resilience and decreasing the risk of the hyperpigmentation. So probably people will not come to you in the next October with pigment spots. But they will come with something else, right? So Lumino Derm brightening skincare is anti-inflammatory, antioxidant, microbiome friendly, and what is very important for me, it is inclusive. It is safe for sunny period of the year. It is safe to use for people with all skin types, including sensitive skin, acne skin, rosacea, and people with darker skin types as well. And also it slows down the aging, calms down the skin, and it is pregnancy safe. Because I believe if the ingredient or the product it's not safe enough to be applied on the skin during the pregnancy, it should not be applied on the skin at all. Now we have the new generations of ingredients which are pregnancy safe, good for skin health, they are not toxic. So we should replace potentially toxic ingredients with a new one. And we don't use any kind of potentially harmful ingredients. And actually, I'm trying to not use chemically synthesized ingredient at all. We are using plant extract and laboratory designed ingredients such as peptides, prebiotics and probiotics. So, the first product, I call it Lumino Derm Collection, but actually there are two products, cream and mask. First product covers everything except for lifestyle, because I'm not responsible for lifestyle people. I am sorry. When I was younger, I tried to give people advice. Now I am 52, I am tired. I am desperate. People don't follow advice even of medical doctors. So my responsibility is skincare. Also, I'm not responsible for the sun protection because we don't have sunscreen. I recommend to use sunscreen. It's a whole different story, but we don't have sunscreen in our middle range. I work on it for more than 12 years, and I'm still not at this level of perfection which I think should be done for the sunscreen. Maybe my bar is too high. One day we will launch it, but not this year, and for sure not the next year. So, but what we can cover? Hormone influence. We cover with a new peptide, which called X50 Pure White. I will explain about which ingredients a little bit later. Stress, we cover with licorice extract. Microbiome, we cover with an Ecosin Complex of prebiotics and probiotics. And inflammation, we are covering with tranexamic acid, which is anti-inflammatory. And also cysteamine, to change the ratio of melanin in the skin, reducing dark brown eumelanin and promoting the golden pheomelanin in the skin. So the first ingredient, which is very innovative, cysteamine, derivative of the amino acid called cysteine, which switch melanin to golden. What you should know about cysteine circulating in our body? It's absolutely bioidentical molecule. So it's nothing new you apply on the skin, your body recognizes this molecule. And we know about effect of cysteamine for more than 50 years. It is known from 70s. The safety profile is incredible. Why you never heard about cysteamine probably? And you didn't see cysteamine in the brightening skincare? Because it smells awfully. It's an awful sulfur smell. It is sulfur-based amino acid. And first product based on the cysteamine was launched in America about 5 years ago, Cispera. Great brightening treatment. I prescribed it a lot, but still a little bit smelly and difficult to apply because it should be applied on the very dry skin before applying anything else. Exposed for 15 minutes and wash it off with water before applying everything on the skin. But one of British laboratory in the university finally created the technology of microcapsulation of cysteamine. So it doesn't smell. It can penetrate in the skin in the formulation of the cream, finally, and finally we are able to use it It is very new, and it's really brightens the skin in first 8 weeks of use. It's really changed the melanin ratio in the skin, and it really eliminates melasma and dark spots in about 80% of people. So some people who have the long history of pigmentation, like you have dark spots for 12 years, you should use it longer. But most of people are good in 8 weeks of use. And also what is very interesting about the system, it works on the very high level of the biochemistry. If you remember, it's really third step, the transformation of the dopamine in the biochemical pathway. So it's before the switch, and another point is on the level of the switch. So it's not only on one step of the biochemistry when cysteamine is active. And it increases the intracellular level of glutathione as well. So it creates a powerful antioxidant protection for the skin and protects skin DNA from mutation. So when you use cysteamine-based product, you protect your skin from the ultraviolet. It creates a very powerful inner protection for the skin. Another ingredient, it is a tranexamic acid, which is anti-inflammatory. So here we really control the pigmentation. Tranexamic acid is also known in the pharmacology and in the medicine for many years. It came to us via gynecology because tranexamic acid was used for the gynecology bleeding treatment. And in the same time, it was found that for some reason it lightens the skin. And actually it was explained that it lightens the skin because it suppresses the inflammation and also restores the microcirculation in the area. It's really calm down and reduces the inflammation globally, including the inflammation in the capillary network. And it prevents the skin aging, so it's anti-aging ingredient and brightening ingredient in the same time. And what is really forgot to mention then, tranexamic acid is anti-aging also because it activates the phenomenon called autophagy in skin cells. It's so-called cells suicide. Because it sounds awful, but in aged skin, we have more and more non-functional skin cells. Because aged fibroblasts are not the same as young fibroblasts. When I hear about, let's take fibroblasts from 50 years old skin and just inject it in other areas of the skin, if we can take fibroblasts from 20 years old skin and inject it in 50 years old skin, it will make the difference. But 50 years old fibroblasts, they are not so active and they produce another kind of collagen. In young fibroblasts, we produce more of collagen on first and fourth types, which is called collagen of youth, which is very elastic, which firms the skin, keep it really firm, young, and just perfect. But in older skin, collagen is less elastic than other types of collagen, and why we have the change of jawline, formation of wrinkles. So sometimes it is not a good idea to stimulate older fibroblasts to produce more of collagen. Because if they produce more of old collagen, we'll be in trouble. But our body has this phenomenon called autophagy. So when the cell is aged, it kills itself. And it's one of the natural mechanisms of the aging prevention and cancer prevention. But older we are, less efficient the autophagy is. But tranexamic acid can reactivate autophagy in skin cells. So when you apply products containing the tranexamic acid, it's not only brightens the skin, calms down the skin and controls the inflammation, but also it really globally and deeply slows down skin aging. Third ingredient, it's very innovative and revolutionary peptide, also called Cosmeticdrone. It has 3 parts. So they are two peptides. And between them, they, believe me or not, glycolic acid, but in the polymer form. And one peptide just stick to melanocyte, pigment cells. Glycolic acid opens the door into the cells. And third peptide injects itself inside, blocking hormone receptors inside and eliminating excessive eumelanin. Doesn't affect golden pheomelanin. It eliminates only excess of dark melanin, blocking in the same time hormonal stimulation. So perfect ingredients for pregnancy mask treatment. Stress-related pigmentation, and actually all kinds of pigmentation is manifesting with dark spots. And it is absolutely safe because all research shows, and it is not absorbed by the body. It works only in pigment cells, and after it's destroying itself and leaving the body with glycolic acid and small part of amino acid used to build these peptides. So it's once again, it's double effect. Hormones and pigmentation treatment. And two of more known ingredients, glabridine, which is an active substance of the licorice extract, used by the traditional medicine for hundreds of years to treat inflammation and pigmentation in the skin. And actually, licorice is able to block cortisol response. So it is anti-stress treatment for the skin. In the same time, anti-inflammatory and moisturizing and antioxidant. Like many of plants extract, it's full of flavonoids. So great ingredients also used for many years for pigmentation treatment with the same disadvantage than niacinamide, slow. If you use product which contains only licorice extract, you will have brightening effect in 1 year. But we use it in combination. So it helps us to create faster response for the skin and most importantly, to block cortisol response in skin cells. And microbiome. Now we promote the brightening, antioxidant, anti-ultraviolet microbiome and suppress inflammatory, darkening microbiome. Ecosin Complex contain many ingredients. First is prebiotic Biochemistry. If you work with Meder skincare, you know Biochemistry from our acne treatment, rosacea treatment, and sensitive skin care, because it really promotes the growth of beneficial bacteria and suppress the growth of Cutibacterium acnes and all inflammatory bacteria. And Cutibacterium acnes, it makes a part of the darkening microbiome. That's why in acne, so often we have pigmentation spots. Also, it's lactobacillus, here, probiotic living bacteria, which helps to promote the growth of all lactic microflora and bifida flora, and also the maltodextrin and yacun extract. Yacun extract, it is Mexican water chestnut, which is superfood. If you eat Mexican water chestnut, yacun, couple of times a week, your gut microbiome will be happy and will produce more of hyper substances, and it helps calm down the sensitive skin, moisturize the skin. So it's a great food, especially for people with atopic skin. But also applied on the skin. It works exactly like in the gut. So it suppresses the inflammatory microflora and promotes the calming, anti-inflammatory, brightening microbiome on our skin. And altogether, it makes a very nice Lumino Derm brightening cream. The base of this cream is Shea Butter. And we are buying Shea Butter from the small farms in West Africa because it's only there. It's produced by traditional method. So they collect shea nuts from only old trees, older than 50 years, collected only in the moment of higher maturity, and after they do all traditional process of extracting the butter without using any chemicals. And it is so different from this cheap version of industrial shea butter, which is literally dissolved with hexane, so it always contains some chemicals. And this one, traditional, it's the best one. It can be used for all types of skin, including oily skin, including sensitive skin. And I was asked in the last couple of months many times, why the cream? Why it is not a concentrate? Why it is not a serum? Why it is not some kind, product which we offer for the active treatment of some aesthetic concern? First of all, cysteamine is impossible to incorporate in the water-soluble form. It will not be efficient. Peptide also works better in the cream, in the fat-soluble product. But also, that's another aspect, psychology. Brightening treatment, it is a treatment which asks people to be consistent. Consistency is the key, like with an acne treatment. So the product should be applied on the skin every day, twice a day, the best option. People apply product on their skin twice a day only if they love product. They will promise you to apply product, but they will not do it if they don't like how it feels on the skin. So we created, I am very proud, it's probably the best texture we created in 15 years of the brand existence. And it's really at maximum silky, addictive, lightweight cream which you apply and you love it from the first touch. So I really hope people will be able to apply it day by day, 8 weeks and more if they need it. And it contains all these ingredients which covers all triggers of pigmentation, excluding ultraviolet. After the cream, you should apply the sunscreen if you go out, and lifestyle, obviously. Antioxidant food, physical activity, good sleep are still important. And the recommended price of the cream is $115 American. One bottle of the cream, 50 milliliters, airless pump, it's enough for 2 months use. And we recommend to use it day and night. Just replace your day and night moisturizer by the Lumino Derm cream. And it eliminates dark spots, eliminates melasma. You will see first changes in 2 weeks after you start use the cream. So the pigmentation start to be dispersed. We show it with observe, with photo, so it start to lighten and it start to, become more dispersed on the skin. And we've had the first positive feedback from people who started to use product in 4 weeks. Some people start to contact skincare therapist or our support asking, I'm okay, I'm using cream 4 weeks, my dark spots are eliminated. Should I stop? No. 8 weeks, please use it 8 weeks, because skin cells, they live long. You should re-educate them. So even if your dark spots eliminated earlier, keep up and use it at least for 8 weeks. Better 12, 16 weeks if the pigmentation has a history. It's always better to give time for skin cells to be re-educated. And second product, which we launch in Lumino Derm collection, it is a mask. Mask is for maintenance and prevention. Cream is for active treatment. Mask covers the same triggers as the cream, but differently. And mask we recommend to use once a week. So for hormones, we cover hormones with another peptide called melanostatin. Stress, we called with resveratrol, famous anti-age antioxidant from the red wine and red grape. For microbiome, we are using complex of living bacteria. Actually, that's a Greek yogurt. Because can you imagine what 3 of antioxidant, anti-ultraviolet bacteria were found in the Greek yogurt culture? And once again, grandmother was right. Greek yogurt is good for your skin. So we literally created a mask on the base of Greek yogurt with all these new innovative advanced peptides and everything, but with bacteria from Greek yogurt. And in the brightening treatment, it's always good to eat Greek yogurt for the breakfast, at least a few times a week, because it helps to promote the growth of brightening microbiome on the skin. And gluconolactone to control the inflammation, and alpha-arbutin, which you know for pigment control. If you use alpha-arbutin on the daily basis, it can be sensitizing. But if you use alpha-arbutin once a week in a mask, it controls the pigmentation without any sensitizing effect. So, melanostatin, chemical name is nonapeptide 1. Nona, it means that there are 9 amino acids in this peptide, so it's quite big, but it still penetrates into the skin in the mask because mask improves the permeability of the skin. If you want to intensify, maximize results, please use microcurrent therapy on the top of the mask. You can do it in the treatment room, but also you can recommend to your clients, patients, to use home microcurrent therapy devices. I recommend for years MyoLift, which probably you all know about it. Best device. If you ask me, the best device ever. I use this device myself, and it works really great on the top of the mask because mask contains 30 milliliters of conductive gel. Also, it's possible to use LED therapy, also in the treatment room or at home, with a blue-green light for more brightening effect. So another option. Nonapeptide 1 inhibits the hormonal activity in pigment cells. And also it slows down the aging once again because it's not only inhibits the melanin synthesis, it really stimulates the collagen synthesis in the skin, and it really prevents the damage by ultraviolet radiation. You can use this mask in the summertime, before holiday. If you're planning to go on the beach on Sunday, use Lumino Derm mask before, and your skin will be not only brightened, but also better protected. It's probably the first product in the world which helps to protect your skin while it brightens the skin. Another ingredient, gluconolactone, stimulating inflammation, and it exfoliates the skin. It's a gentle exfoliator. It's polylactic acid, which you apply on the skin, it gently accelerates the skin renewal, moisturizes the skin, and calms down the skin very efficiently. So when you take off the mask, the skin is brightened immediately because you eliminate these dark, dead cells from the skin surface. Resveratrol, famous, powerful, great. We use this resveratrol in Arma leaf treatment. I love it because actually it works like hormone replacement therapy for menopausal skin. It really improves the sensitivity of skin to estrogen, but in the same time suppress the sensitivity of the skin cells to stress hormones. And resveratrol, it's one of the best controlling ingredients against the stress, and stress causes inflammation. And also, it's anti-aging. It is a powerful antioxidant. So one of the most multifunctional ingredients ever. And microbiome, Greek yogurt, 3 living bacteria, Bifida, Lactococcus, and Lactobacillus all together. And this mask contains living bacteria. So when you open, you have this 30 milliliters active gel with living probiotic inside it. And it restores a healthy microbiome, healthy brightening microbiome, in the same time reducing inflammation. So that's a great mask to use if you're prone to the inflammation. Even it can help to prevent period breakout. So it can be really universal. I think it can be one of the competitor of Hydrofill mask, which is everyone loves Hydrofill. I never met people who didn't love Hydrofill moisturizing mask, but Lumino Derm, I think it's will be next favorite one. And so we have peptide, we have resveratrol, we have polylactic acid gluconolactone, we have 3 living bacteria complex, and we have hyaluronic acid as a base of the mask and peptide called skin essential, which calm down the skin and helps to prevent all kinds of sensitivity and allergic reaction. And alpha-arbutin to control pigment synthesis via inhibition of tyrosinase enzyme of the pigmentation, so there are 2 levels in the pigments biochemistry. We have masks in box, 5 masks, 5 weeks, easy. Or you can offer masks by sachet. Recommended price of sachet is $20. Recommended price for the 5 sachet box is $90. I recommend to use this mask during active treatment once a week to maximize results, to get the maximum, to intensify the treatment. And after, when you eliminated pigmentation, you stop to use Lumino Derm cream, switch back to your day and night favorite moisturizer, hopefully Meder moisturizer, and continue to use the Lumino Derm mask a couple of times a month or every week if you want it. Also, it can be used in some stress period, it can be used on holiday, and it is the best pigmentation prevention treatment for pregnant women. So at once and your patient, your client announce you the happy news and I'm pregnant, please offer Lumino Derm mask to use at least a couple of times a month to prevent pregnancy mask development. So absolutely easy. 2 products, one for the active treatment, another one for prevention and maintenance. And just to remind you how great we are in Meder skincare. That's a new product which we launched in this year, 2024, after 15 years of the development. And we started as a small brand founded by me, stubborn dermatologist, who wanted to use probiotics and peptides. And 15 years later, it's still stubborn me, 15 years older. But we are still independent brand, but we are in more than 30 countries over the world. Now, to be precise, there are 32 of them. We have almost 2,000 clinics over the world working with our products. More than 500 British dermatologists recommend and prescribe Meder skincare to their acne and rosacea patients because it really helps to get best results from even medical treatment of severe forms. And we did our math last year and found that every 15 minutes, someone in the world buys 1 Meder cleanser. Probably it's not very impressive for L'Oreal, but for me, it's still impressive because I never thought that brand can be global when I launched it. I launched it only because I wanted to offer safe, efficient, innovative solution because big brands refuse to this new idea. And now everyone is using peptides and probiotics. Finally, I'm very happy when I see big brands saying that they're first in the world to use peptides. Okay, be first. But people should get safe treatment based on the safe, non-toxic ingredients. And that's what we do. That's our motto. Skin should be healthy, and healthy skin, it is active longevity for the skin. So it is a skin biohacking. And thank you very much for your attention. And now, thank you for everyone who is watching the video. Time to stop.